and director at Protect Our Care. And I'm so excited because this morning we have an excellent lineup to talk about a new poll from Global Strategies Group on behalf of West Health, showing that there is strong support among Delaware voters for prescription drug reform, including broad support for allowing Medicare to negotiate for drug prices for all Americans. So today, our first speaker is going to be Brad Woodhouse. He's the executive director of Protect Our Care and our fearless leader. He'll walk through the poll results for you and put it in a political context so that you can understand it as the momentum in Washington is building around prescription drug reform. Then we're going to be honored to be joined by Sarah McBride, state senator from Delaware's 1st District, and Vanessa Ladson, a Dover resident who has herself faced the high cost of prescription drugs. Following these remarks, we're going to be able to open it up to Q&A if there's any questions from press. So I'm going to go ahead and turn it over to Brad Woodhouse. Brad?
Great. Thank you, Ann. And I may be your fearless leader, but we couldn't do any of this communicating without a stellar communication team led by you and our team there at Protect Our Care. So I want to thank everybody for joining us. I love Delaware, by the way. It's an awesome, beautiful, wonderful state. Kelly, if we could put the slides on the screen and just talk a little bit about where we are before we get into the actual presentation, kind of where we are in this country as it relates to healthcare. We have done tremendous work. I hope everybody got a chance to see the video that President Biden and former President Obama did together over the weekend, celebrating the fact that more people, 31 million people, more people than ever, are covered by the Affordable Care Act. Of course, that was difficult law to pass. It was difficult law to implement. We had no Republican support, but we kept at it and kept at it and kept at it, and we fought hard and stopped President Trump and Republicans from repealing the Affordable Care Act. And we've brought better health care to more people through Medicaid expansion, through the exchanges, through the protections for people with pre-existing conditions. And we're even doing more. President Biden has expanded the number of people eligible for tax credits and subsidies, and that will lower costs for people. We're going to make those provisions permanent in the American Families Plan, and we need to do more. We need to get the states that have held out on expanding Medicaid to either expand that or implement a federal solution to get those people covered. So the next we're going to talk about here, the next big frontier in dealing with healthcare costs is addressing the high cost of prescription drugs. And I want to thank West Health, Global Strategy Group. West Health sponsored these polls. This Delaware poll, Global Strategy Group conducted this polling, and West Health was generous enough to share this with partners like Protect Our Care that are doing the advocacy work around lowering healthcare costs and lowering the cost of prescription drugs. So with that, Kelly, let's go to the first slide. So healthcare costs and prescription drugs are high priorities for voters in Delaware. This is not news to us at Protect Our Care. We've been tracking these issues for 4 years now. We've done a lot of national polling, a lot of state polling, and healthcare costs are always right near the top when it comes to what voters want, the issue priorities they want for Congress, for the United States Senate. Here you'll see basically a top 10 list. Healthcare costs are right at the top. Prescription drug prices is also very high. That question could have been asked, just prescription drug prices, or I don't know. The combination of the two, though, is extremely powerful. It's extremely powerful politically. And the two together are a very high priority for the people of Delaware and incidentally for the American people to solve. Next slide. So most Delaware voters believe prescription drug prices are going up. Well, there's a good reason for that, because they are going up. They are going up year over year. They go up higher than the rate of inflation. We see the biggest brand name drugs, the drugs that are most used for big diseases like diabetes. We see these prices going up every year. And there's almost no correlation between the price increase and any benefit to patients, no improvement in these drugs, no therapeutic reason for these prices to go up. So you see 67% of Delaware voters believe prescription drug prices are going up, and they are, but they're going up almost entirely to the benefit of the profits of pharmaceutical companies, not in improving these drugs. So then thinking about the last 12 months, we asked voters, has there been a time when you or someone in your household could not pay for medicine or drugs prescribed to you by a doctor? Well, 26%. I mean, that's, 25 people out of 100 walking down the street, according to this poll, are skipping out on drugs because they cannot afford them. I mean, in this country, with all the wealth that we have, with all of the money that the federal government puts in to research and development of drugs and therapies and cures, the fact that 25 people out of 100 walking down the street have either them or a member of their household could not pay for medicines prescribed by a doctor, it's unconscionable. And then here, thinking about the last 5 years, there's been a time a friend or family member passed away because they could not afford a necessary medical treatment. 10%. Well, some people say, well, 10% is not a lot. Well, let me tell you something. If one in 10 people walking down the street have a friend or family member who's passed away because they could not afford a necessary medical treatment, and many of those necessary medical treatments involve drugs, that is unconscionable. Not in the United States of America should people be dying, or should people's health be imperiled because of the high cost of prescription drugs. Next slide. So, not surprisingly, Delaware voters believe drug prices are going up, and they support requiring drug companies to negotiate with Medicare for lower drug prices. We've seen this in poll after poll after poll. Whatever's going on in the rest of the world, the height of COVID, whatever else has captured the public's attention, there is always somewhere between 80 and 90% support in states that we've polled, in Delaware, according to this poll, and in national polls, for requiring drug companies to negotiate with Medicare. Part of it is because it just makes common sense. I mean, it kind of blows your mind to think that the largest consumer of drugs in the country is prohibited from negotiating for lower prices. In other words, pharma has all the power. The big drug companies have all the power in terms of selling to the federal government for the Medicare program. Well, that doesn't make sense. I mean, you go in, you negotiate a car price, you negotiate a house price. Government institutions negotiate with vendors all the time and with contractors all the time. But we're prohibited here. Well, the people of Delaware think that's crazy. 88% support total, and it is across the board: white, black, Hispanic, non-college, college, below 55, above 55, Democrats, independents, and Republicans support requiring drug companies to negotiate with Medicare for lower drug prices. Next slide. And most are in favor of letting Medicare negotiate lower prices rather than the government simply limiting price increases to the rate of inflation. And so this gets into some of the policy choices that have been discussed. And there is 2-to-1 and across party lines too, 2-to-1 support for giving Medicare the power to negotiate prescription drug prices rather than simply limiting drug increases to the rate of inflation, which wouldn't allow for negotiating down the exorbitant prices that are already being paid. And then, and not surprised, I don't think this is surprising either. What if the choice is to give Medicare the power to negotiate prescription drug prices for all Americans, including those who get insurance through an employer, or simply to negotiate for lower prices on behalf of Medicare beneficiaries? Well more than 2-to-1 support those price reductions through Medicare negotiation applying to all Americans, and they should. If they only applied to Medicare, you can well bet that the pharmaceutical companies would make up the difference in raising the prices on everyone else. Everyone that pays prescription drug prices in this country deserves a break. We pay 3 to 4 times what people pay for the same drugs in other countries. So once we get Medicare negotiation in law, those price reductions should apply to all patients. Next slide. And voters believe the benefit of reducing prices outweighs the negative impact on innovation and standards. So here's a couple arguments you'll get from the pharmaceutical companies, and in a common sense way, the one on innovation doesn't make any sense. So basically, you know, what they would tell you is, well, if you lower our profits, if you allow Medicare to negotiate for lower drug prices, we're going to stop innovating. We're going to stop creating new drugs. That doesn't make any sense at all. They have a responsibility to their shareholders. They are in business to create new therapies, to make money, to bring new innovation to market. They're going to continue to do that. And by the way, most reporting shows that there's more spent on marketing and executive pay and shareholder payouts than there is in innovation. So certainly there is room. There's room for reducing the overall price of prescription drugs, and they can continue to innovate. And the last thing I'll say on this is a lot of the innovation and research and development that goes into drugs and therapies is paid for by the taxpayers already. It's done through the National Institutes of Health. Taxpayers spent $19 billion researching and developing the COVID-19 vaccines that we're all getting in line for, I hope, today. So here you'll see 76% believe Medicare should negotiate with drug companies to make drug and medications more affordable to patients, rather than only 14% believe letting Medicare dictate prescription drug prices will undercut drug companies' ability to innovate and develop new drugs. This is their argument. Pharma's argument is we won't be able to innovate. People don't believe it. 76% of Delawareans don't believe it. 81% of Democrats, 76% of independents, and 69% of Republicans. And then thinking about prescription drug reform, which of the following come closer to how you feel? Now, this involves what the pharmaceutical companies were trying to scare people about international pricing or making our prices here more fair with the international market. So Americans, 63% believe Americans of Delawareans pay too much for brand name prescription drugs, almost 4 times what people pay in Germany, France, and Japan, versus only 23% who buy the argument that letting Medicare negotiate prescription drug prices based on international standards will be importing price controls from other countries that do not have the healthcare system as strong as the United States. People don't believe that. They don't buy that there is a reason for the unfairness in prices. We pay 3 to 4 times what people pay in other countries. There's no reason for it other than profits that go to pharma. So this is the last slide. So let me sum up and kick it back to Ann. As you can just see from these results, this is motherhood and apple pie. If you're a politician, you can't be for something where 88% of the American people, or 88% in this case of voters of Delaware, support a policy. I mean, you know, people say, well, pharma does have a lot of money. They have the most lobbying money of any industry. They have the most campaign money of any industry, but their arguments are weak. They are weak sauce. You know, politicians, members of the Senate, members of the House of Representatives, President Biden, they can all take on pharma because they got 88% support in Delaware. And we've seen 90% support nationally. This is motherhood and apple pie. HR 3 is the embodiment of this right now in the House of Representatives. It would give that power to Medicare to negotiate on behalf of people like Vanessa, who we'll hear from in a minute. And we just have to get it done. Ann?
Thank you so much, Brad, for walking us through that. It's very stark numbers in that poll. I now have the pleasure of turning it over to Sarah McBride. As I said, Sarah is a state senator from Delaware's 1st District. And actually, I had the pleasure of working with Sarah a few years ago, many years ago now, but when she was starting out in her career. And I've so enjoyed watching her campaign and following that. And I can say Delaware is lucky to have such a tremendous advocate on their behalf. And so we're so grateful that you're here today talking about this important issue. So Sarah, can you tell us a little bit about what you're seeing in Delaware on the issue of prescription drugs?
Yeah, thank you so much, Anne. And it's great to see you again. It's great to reunite in our collective advocacy work. And thank you so much to you and Brad and the whole team for all the work that you're doing and for inviting me to join you all for this incredibly important discussion. You know, at the heart of my service is both the new state senator for Delaware's 1st State Senate District and the chair of the Delaware Senate Health and Social Services Committee is, of course, the effort to ensure that every Delawarean can get the health care that they need to live and to thrive. Too many Delaware families continue to face the impossible choice between getting well and getting by. And for patients across our state, the cost of care has been unbearable and in many cases insurmountable. Delaware already spends more per capita on healthcare than almost every other state, but that spending is not leading to better outcomes, with Delaware actually ranked in the bottom half of states in health outcomes according to one study. And indeed, that spending is creating significant, often increasing barriers to care for Delaware families. Now, today in Delaware, nearly 150,000 Delawareans have avoided medical treatment because of the cost in the last year. And 1 in 4 Delawareans could not afford prescription drugs or medicine because of the cost. You'll be hearing in a little bit from Vanessa Ladson today about the challenges her family faces in affording prescription drugs. And her story is a powerful reminder of the stakes for families, but it is sadly one of far too many stories. Every day on the campaign trail and routinely now that I'm in office, I hear from Delawareans of all backgrounds, and especially our seniors, about the cost of prescription drugs and medicine. People who've sacrificed food to afford medication, parents who've given up their own prescription drugs to afford their child's treatment. And the results from this poll reinforce what I've seen on the ground, that this is a significant issue and a priority for Delawareans. That is one of the reasons why the Delaware General Assembly has taken meaningful steps to reduce these costs for patients. In fact, just last month, the Delaware State Senate passed legislation addressing out-of-pocket costs for insulin for patients. We are doing what we can, but ultimately we need comprehensive federal action. And perhaps the most meaningful step that can be taken to address the life-threatening problems of the cost of prescription drugs is to empower Medicare to negotiate with drug companies to lower prices. From my perspective, and from the perspective of pretty much every Delawarean that I've talked to, certainly 9 in 10 Delawareans, the current reality is simply unfair. Drug companies are seeing record profits while patients face skyrocketing prices and barriers to care. And those rising prices, as Brad talked about, they're leading to record profits, not resulting in an increase in research and development. Indeed, taxpayers are already subsidizing innovation, including the more than $19 billion of government funds invested in the COVID-19 vaccine. Giving Medicare the power to negotiate with drug companies will save lives and save money, both for patients and for the government. And we can do it in a way, as you've heard earlier, that not only lowers the price of prescription drugs for Medicare recipients, but for all patients. I'm so incredibly excited that H.R. 3 has momentum, has broad public support, because it is a legislation that we need here in Delaware and that we need nationally. And my colleagues in the Delaware General Assembly will continue to take steps to lower prices, eliminate barriers, and improve outcomes. But to truly address this critical part of the equation, we need Congress to act. That's why I'm here today. And I look forward to continuing to work with advocates nationally and here in Delaware to make sure that H.R. 3 passes and that we take this important step to save lives and save money. Thank you. I'll turn it back over to Anne.
Thank you so much, Sarah, for those powerful words. We are going to now turn it over to Vanessa Latson, and she is a resident in Dover, and she faces the problem of prescription drug costs in her own life and is here to tell her story. Vanessa? Make sure you're off mute, Vanessa.
Good
Thank you.
morning. My name is Vanessa Ladson, and I'm from Dover, Delaware. I live with both fibromyalgia and lupus, which is an autoimmune deficiency disease where my body's immune system fights itself. It attacks, the good immune attacks the bad immune. To manage both of these conditions, I must take 12 medications per day. The prices for these drugs really add up. Just 3 of those medications, Plaquenil, gabapentin, and Eliquis, cost me $500 out of pocket each month until I hit my Medicare deductible. And it's not only my medications. My husband lives with prostate cancer, and his prescribed Zandia, which costs $200 per month without assistance that we get. It is horrifying to think of what would happen if we lost this assistance. Already the price of the drugs that we both need to survive are incredibly financially straining, as we only have income from Social Security and my small retirement fund to rely on. I have no scrimp, and I have to scrimp and save, and sometimes I go to my children to help me with my financial. There has been more than one occasion when I have had to ask grown children for help buying my prescriptions, which I absolutely hate. At times, it all makes me feel helpless. Sorry. The combination of living with my physical condition and dealing with these high drug costs have made me depressed. Simply put, I cannot live the kind of life I want to live. I should be able to afford medication without so much worry on top of my illnesses and symptoms. My husband and I sacrifice a lot in order to be able to live, but I know other senior citizens who are much worse off than we are. Other countries help out their seniors by negotiating for fair drug prices. As the richest country in the world, the United States should be able to make our prescription drug affordable. That's why we need seniors, Carper and Coons, to stand up for Delaware seniors like me and my husband by passing legislation to let Medicare negotiate for lower drug prices, and on behalf of Americans. People like us cannot wait any longer. We need this change now. Thank you for letting me say my part. It's really important to the seniors to have their drugs. I mean, like I said, I know other people that are worse off than I am, and I'm just blessed that my children are able to give me if I need. Thank you.
No, thank you, Vanessa. Thank you so much for sharing your story. And, I think it just really lays bare why we need this reform, and we need it now, on behalf of you and everyone who's struggling to afford their prescription drugs. So we thank you for sharing that today. I'll now turn it over to Q&A. Kelly, do we have any questions? Can you go through how to reporters can ask questions?
Yeah. Thanks, Anne, and thanks to all of our panelists today and for everyone who is joining us on Zoom. I see some folks with hands raised, but it would be more helpful if you could enter any questions for our panel into the Q&A box at the bottom of your screen, and we will read those questions as they come in. So again, if you have a question for the panel, please go ahead and use the Q&A function at the bottom of your screen to submit that question, and we'll be reading those as they come in. And we did have one question for the panel coming in. The question says, We know that public opinion doesn't always lead to change in Congress. Why is now the right time for legislation like HR 3 that would finally give Medicare the power to negotiate for lower prescription drug costs?
I would defer to the senator on that if she wants to start.
Well, I'll start. I think, heading into the Delaware General Assembly in the midst of a global pandemic has been incredibly illuminating. And chairing the health committee amidst a global public health crisis has certainly reinforced the stakes. I think the time is different because we are seeing just how necessary real access to affordable healthcare is to not just our own individual health, but broader public health and a thriving economy. So I think the current pandemic has really driven home just how necessary progress on all of these issues is for not just the seniors who are struggling to afford prescription drugs, not just families who are trying to afford medication and treatment and having to sacrifice buying food, but for all of us, for our businesses, for our schools, for our entire economy and our entire country. And so I think that the current public health crisis that we're in has truly reinforced for us the need for progress, not just when we're facing a global public health crisis, but for the millions of individual health crises that people are facing every single day.
Yeah, I'll just add to that, Kelly. Why now? We just can't afford. We can't afford to wait. People like Vanessa can't afford to wait. But why now? Well, frankly, this is a priority and has been a priority for Democrats for decades. We now have Democratic control of the United States Senate, Democratic control of the United States House of Representatives, and Democratic control of the White House. I would like nothing more than to have Republican support for lowering drug prices substantially, and the best policy to do that has been identified through decades of research and analysis is to give Medicare the power to negotiate for lower prices, because the pharmaceutical companies aren't going to do it on their own. And this is a once in a generation opportunity. We have a short window here, and President Biden is trying to accomplish a lot, and he has accomplished a lot. But if we can't do this when we have Democratic control of the House, the Senate, and the White House, I can't think of a time that we'll get it done otherwise. We should do it while we have the politics in our favor.
Thank you, Senator McBride, and thanks, Brad, for those answers. We do have another question coming in, and this question comes from Nicholas Florco at Stat News. Nicholas is asking why we're focusing on Delaware here today, and if that says anything about how we're thinking about Senators Coons and Carper, where they're at on HR 3.
Well, I'll start. I won't put Senator McBride or Vanessa on the spot for that one, but this is not the only state we're doing this in. Protect Our Care is in 12 states, including Delaware. But we need the votes of every Democratic senator if we want to get this done. And we know that in a state like Delaware, the pharmaceutical companies that are based there are going to lean on politicians of all stripes, probably state senators as well, on the issue of prescription drugs. So what we want to do, we're not hammering anybody or beating anybody up. We want to present the data that shows that what constituents want, which is what people run are the people that politicians run to represent. What the constituents want is something serious and substantive to deal with high prescription drug prices. And we would hope every Democratic senator, including those in Delaware, would. But we're not doing this just in Delaware. Like I said, we're in a dozen states around the country, and these particular polls were conducted in four states, but we've conducted polls in almost all the others.
Thanks, Brad. There's sort of a follow-up question to that question that we have coming in. And the question asks, how can Delaware senators work with others in the Senate to pass drug reform? Anyone wants to chime in there?
they're talking about the 2 United States senators.
That's right.
Well, I mean, I think the caucus has got, it can't just be on any 2 senators. The caucus has to work. There's a process for this. The Finance Committee is a place in the Senate that has jurisdiction over this. But I would say that the first thing to do is look. We think it's the floor, not the ceiling. Is the legislation that's been introduced in the House of Representatives that passed in 2018 or 2019, passed and then went over to Mitch McConnell's legislative graveyard. And that's HR 3. Is HR 3 then? It's HR 3 again, and it gives Medicare the power to negotiate for lower drug prices. And let me add that this is not just an opportunity to lower prescription drug prices for every American. Remember, if Medicare gets to negotiate for those lower prices, there are savings to the taxpayers that can be spent on other things, particularly inside of healthcare. We could lower the eligibility age of Medicare. We could add benefits to Medicare for vision, dental, and hearing. We could possibly use some of those funds to expand Medicaid in the remaining states if these Republican legislators and governors continue to refuse to give low-cost health care to that cohort of the population. The federal government could come up with a policy solution on its own that could be funded partially out of these savings. So the gain is not just, and it would be great if it was, but it's not just to lower the cost of prescription drugs, but it could be to provide expanded health care and improved health care access to millions of other Americans.
Thanks, Brad. And thanks to everyone who is joining us on Zoom. And it looks like those are the only questions that we have coming in at this time. So I will turn it back over to you.
Thank you so much, Kelly. Well, with that, we'll wrap this up. I just want to thank again, State Senator Sarah McBride and Vanessa Ladson. Thank you so much today for joining and for giving your perspective on Delaware. And Brad Woodhouse from Protect Our Care. We are just starting a summer of events around this issue, and we're going to be working hard to make sure that that we get a prescription drug reform, including allowing Medicare the power to negotiate. So keep looking for more events soon from Protect Our Care. Thanks everyone for joining today.
Thanks, Ann. Thanks, Senator. Thank you, Vanessa.
Thank you.
Well.